We are going to have the most spectacular new, ultra modern, beyond belief laboratory. That everything is going to be beautifully automated for perfect safety and great control. And I can't praise the work enough that our people have been doing and making the most up to date, beautiful, modern IVF laboratory I've ever seen. And but it's not going to be available until January. And so obviously we're at mid-December, and so we're putting on some of the final touches, and it'll be in mid-January that we're actually ready for that opening. And here's what's happening now in IVF, and it's the new trend that most places have not really picked up yet, but everything in the lab is going to be fail-safe. I mean, we will have perfect petri dish control so that it's impossible for anybody to make a mistake or a mix-up. Well, we still prevent any mistakes or mix-ups by having multiple checkpoints. But in addition to the usual checkpoints, we're going to have digital control so that it's going to be impossible to actually make a mistake. And this is what's happening in the IVF world now. For the frozen specimens, it's incredible. It's a machine called Tomorrow that it's been approved by the FDA, and no longer do embryologists have to stoop over a little tank with liquid nitrogen and try to see where the label is and lift it up quickly, because it'll just all come out to you in a perfect drawer. And eye control and retinal control and password control. The safety is amazing, and if anything, it anticipates with AI whether or not there might be a malfunction coming up in the future before it happens, so you can immediately address the malfunction. And it's just a foolproof safety lab. Of course, nothing can replace the embryologist being of the outstanding quality, and we have a new group of incredible embryologists, plus some of the old ones, who are absolutely amazing. They're from all over the world, really, and they're the best there is. So we're very excited about that. It will be an offsite center, not at the hospital itself. It's going to be at a separate independent center in an absolutely beautiful neighborhood, really not far from one of the most popular restaurants in St. Louis, and next to one of the most popular shopping centers. But it's going to be off to the side of that in its own little beautiful private area. Never any parking problems. You just pull right up to it. It's a freestanding, separate center that's going to be much more convenient, particularly for nervous patients that are about to undergo IVF. And now we're still going to have our office in the usual space. We'll be at the hospital and St. Luke's Hospital, and none of that's going to change. But it's just that we're going to be doing the IVF in this totally up-to-date modern facility.